Hello friends, let us now learn some important points about the general pharmacology. So, in the general pharmacology, first, what is a drug? So, drug is a chemical with a noun size structure that will alter the pathophysiological for therapeutic gain. So, it is a chemical which will help us to alter the pathophysiological processes of our body for the therapeutic gain. The sources of drugs. Drugs can be from mainly three sources. One, we have natural sources of drugs which include plants. In the plants, the drugs are obtained from reserpine, physostigmine, morphine and quinine are the drugs which are obtained from plants. The drugs which are obtained from animals are insulin, growth hormone, exenatide and lepidolin. The drugs which are obtained from microorganisms are antibiotics. There are some semi-synthetic drugs which are obtained from plants but are modified. For example, morphine is obtained from plant but that is synthetically modified as apomorphine. Then we also have synthetic drug. In synthetic drug, we have to learn about rational drug designing. That is, the drug is designed in such a way that it binds to the specific receptor, and that drug it binds to a specific receptor so that and the corresponding ligand for the specific receptor in the body cannot bind. Only the drug will bind. That means, for example, if you do ACE inhibitors, these ACE inhibitors will bind to the ACE receptor, this enzyme, and inhibit the enzyme and won't let the angiotensin 1 or 2 to bind to it. Right? Then if you see the next source of synthetic drugs are designed from genetic engineering. So in this, if you see, synthetic drugs are mainly designed by genetic